Well, the measles outbreak continues to spread in Texas. There are now 8 measles cases in the DFW metro area, 2 cases in Denton, Tarrant, Collin, and Rockwall counties so far each. And none of these cases are reportedly connected to the outbreak in West Texas. But health officials are warning anyone who is not vaccinated to be very careful of exposure to the virus. So this morning we have Dr. Karam in with us in studio to talk about the measles outbreak specifically and how it impacts children and parents across North Texas. You've been a pediatrician in the area for more than 40 years, and you've also seen the measles firsthand. You've experienced it as well, so we're excited to get your perspective.
Yeah, Dr. Karam, again, thank you so much for waking up early with us and for coming on this morning. So we want to get to the first question really quickly. For parents, Madison and I are both moms to little boys. So for parents that are just hearing about these outbreaks and they're now getting closer and closer to home, what should we as parents be doing for not only our kids, but for ourselves as well?
Sure. So first of all, thank you for having me this morning. The best way to prevent measles from happening is immunization. The measles, mumps, rubella vaccine is currently the one available in the United States. It can be given as young as 6 months of age, especially during an outbreak situation. That is something for parents to consider. They need to talk to their pediatrician, though, first and see if it is appropriate for that child. By far and away, the most efficient way and the best way to prevent measles is immunization. Of course, you can avoid going into areas that may have measles. That stands to reason because it is a highly contagious disease. In fact, probably the most highly contagious disease known to man. So immunization first and avoidance of being exposed.
So my child is only 2 years old, so he's only had the first dose. How important is it to maybe get that second dose, or can you even get that second dose if you're not of the 4-year-old age group?
Oh, yes, you can. So even if you've had one dose and you're 1 to 3 months out of that one dose, absolutely you can get the second dose. And so if measles is in your community, if measles is in your school, if you are just a very concerned parent, you can get that second dose, and it counts as a second dose, and you don't have to have a third dose unless some strange extenuating circumstances pop up.
Well, we talk about measles, and the CDC said that originally in 2000 that it had been, quote, eliminated from the United States. Now, of course, we're seeing it back in our communities. So is there concern that other diseases, other viruses could start coming back that also once had the eliminated status?
Of course, and that is happening right now here in the United States. Just take pertussis, for example, or whooping cough. Pertussis cases this year in the United States are numbered about 6,000, more than on pace for what we had last year, and there have been unfortunately 2 deaths in the state of Louisiana reported. So other diseases are going to rear their ugly heads if parents don't immunize against all of these diseases of childhood. So parents who are not immunizing against measles often don't immunize against whooping cough and diphtheria and polio and 2 forms of meningitis and pneumonia, and we can go on and on. So I think that we're unfortunately the larger population we have who are not immunizing at all, the more likely we are to see these infectious diseases that we thought were gone.
Right. Well, Dr. Karam, I mean, you have decades of experience, obviously now in practice, but tell us, you've also had measles yourself, so you can actually speak from experience when you talk about measles.
Yes, I can. I recall measles as a child. I was 3 or 4 years of age. I grew up in rural South Louisiana. Medical care was quite limited there. My mother was a nurse. She passed away last summer, but I can remember asking my mother, "Mom, how did I feel?" She goes, "Oh, Al, you were so sick." And I can remember looking at my arms and seeing the rash of measles, and the rash that I had had actually bled into the measles rash. So I had what was commonly called black measles or hemorrhagic measles. And I remember screaming with pain when my mother would turn the lights on. And she told me, she said, "Al, you were so sick, I thought we would have to take you to the hospital. I thought you might die." But, you know, fortunately, everything turned out fine. It is not a trivial disease. It is a serious disease with serious complications and a potential for death.
So what do you want parents to take away from this conversation that we're having today?
Right. I want them to know that measles is a serious disease. It is not just a rite of passage in childhood. The disease itself causes horrible complications, including pneumonia, encephalitis, which is an inflammation of the brain, and potentially death. We have a very safe and very effective vaccine that is available at your doctor's office or through the health department. I urge parents, with the utmost urgency on my part as a pediatrician, as a father of 6 children, a grandfather of 10 children, to please get their children immunized so that this epidemic can stop spreading.
Absolutely. Dr. Albert Karam, thank you so much for joining us and being with us today and sharing some insight on the measles virus and also vaccines.
Yeah, to read more about the outbreak that is happening here in Texas and to look out for symptoms and what you need to be on the watch for, just search measles on our website, cbsnewstexas.com.